Hello, I'm Marianne and I'm here with Judy, who's the manager of Warrina Hostel here at Yarrawonga Health. Now Judy, tell us about your role here.
Yes, well my role is Unit Manager of Warrina Hostel, which is part of Yarrawonga Health Aged Care. I have 28 low residential care residents and we strive at Warrina especially to allow our residents to be independent with their living skills. We support them with their living skills. We're very mindful of the individual needs and staff support that with their documentation. And we also know it is an absolute privilege to care for the aged.
How do you make sure the residents still feel at home?
We support them with family, communication with family, communication with the residents. We do a lot of documentation about their past life and their needs, and we acknowledge that they maintain those skills within our residential care.
So the whole team focuses on each individual and their needs?
Absolutely we do. I have staff that promote best practice with that, and we certainly do treat everyone individually. Some residents are more outgoing than others, and we acknowledge that, and we support that too.
Naturally, some people will be a little apprehensive about going into care, so how do you help them with the transition?
Well, one thing that I'd acknowledge, quite often some of the residents have been quite socially isolated over 3-4 years. Their families live quite a distance away, and when they enter an aged care facility, they feel quite alone for a little while, and slowly with support, over about 3 months, there's often a big turnaround, and they gradually start integrating, start having a social life again, start doing all those things like bingo, cards, craft, and become very happy people. And I think that's just lovely to see. That's very, very important.
Thanks, Judy. So if you or your loved one are thinking about moving into aged care, start the planning now and contact the supportive team like Judy at Yarrawonga Health.